Ladies and gentlemen, we will begin in 60 seconds from now. In the interim, kindly share the link with your family and friends. This talk will not only help elderly women, but also help younger women and also men, since men are also prone to breast cancer. In fact, this is something I realized when I talked to our guest speaker very recently. In addition, your spouse would also need to know what needs to be done in case you are infected. So get all your friends, your relatives from across the world, irrespective of age or gender, or irrespective of where they are located across the world, and gain from this very informative session. We will begin in just 30 seconds from now. Good morning, ladies and gentlemen. Welcome to the 6th Virtual Knowledge Worth Having series, organized by the Catholic Gymkhana Limited. Ladies and gentlemen, as always, our virtual shows come to you live using two platforms of communication, Zoom and our very own dedicated Catholic Gymkhana YouTube channel. Both our control rooms this morning are manned by two specialist resources, Aubrey Chatelier and Managing Committee member Ian Pereira, who jointly will assist us in having a smooth transition, including uploading slides at the relevant time. Since technology involves dependency on external factors like internet, we run the risk of losing internet connectivity. In such an eventuality, please hold on and do not switch off your TV sets or other streaming instruments that you may be using. The speaker losing connectivity will be back soon if he or she loses connectivity. Please hold on in case there is a break in the middle, and we will join you immediately should there be any issues in between. Let me provide you a glimpse of what you can expect over the next 100 minutes, ladies and gentlemen. We will start off with the introduction of the speaker, and that will be followed by a discussion with our speaker. Thereafter, we will take question and answers from the viewers, and finally, we will end with the vote of thanks. This is your final opportunity, ladies and gentlemen. Just a few seconds to invite your family and friends for this very useful session. For those of you interested in asking questions, please post your questions on YouTube chat. These will be collated by our control room and transmitted to me as the host and the compere, and of course will get answered by none other than Dr. Gabula herself at the very end. Ladies and gentlemen, this morning, in the absence of the president who is currently traveling, the privilege of introducing our lady guest speaker goes to another very popular lady, the Assistant Secretary of our Gymkhana, the Vice Chairperson of the Entertainment Committee and the Chairperson of the PR and Communications Committee, Mrs. Yvette Malgi. In fact, I'm wondering what this thorn is doing in the middle of two beautiful ladies, or should I say, in the middle of these two roses. Without consuming any more time, it's my pleasure to call upon Mrs. Yvette Malgi to introduce our speaker to our listeners this morning. Over to you, Yvette.
Thank you, Sanju. Good morning, ladies and gentlemen. The Catholic Gymkhana Limited, Mumbai, is proud to host its most popular Knowledge Worth Having Series 14, a managing committee initiative. The topic for today is breast cancer awareness. As you all know, October is identified as Breast Cancer Awareness Month, and it makes another year in our fight against this deadly disease. This is a day of sharing the beauty, grace, and strength of all breast cancer survivors and their loved ones. Prevention and treatment are the answers, and we are strong together. On behalf of the President, Mr. Vernon Miranda, and the Managing Committee of the Catholic Gymkhana Limited, I, Yvette Malgi, am privileged and very pleased to welcome our eminent speaker, who is a strong woman, a great daughter, an awesome sister, a loving wife, a caring mother, and a brave heart breast cancer survivor. Kudos to Dr. Ismat Gabula. Dr. Gabula is an eminent, independent hospital and healthcare professional, having specialty in radiology. She has been invited by various institutes and platforms to share her experience and steps to fight the good fight against breast cancer, which she does with great passion. Breast cancer, as you all know, knows no boundaries. And Dr. Ismat Gabula is here to help everyone learn about breast cancer detection, prevention, and treatment. She has initiated a program, BSc for Life, to encourage women to take care of themselves proactively, primarily by breast self-examination to support early diagnosis, easier treatment, and significantly improved prognosis for breast cancer. I take this opportunity to thank you all for attending this interactive talk and hope this day fills you with knowledge, enriches your life, and most of all, leave you with hope. So, ladies and gentlemen, please join me in welcoming our guest speaker, Dr. Ismat Gabula, who so generously shares her time, expertise, and knowledge. Over to you, Sanju and Dr. Gabula. Thank you.
Thank you. Thank you very much, Yvette. I must admit, that was a very comprehensive introduction of our speaker, Dr. Ismat Gabula. Thank you. Thank you indeed, Yvette. Ladies and gentlemen, I must disclose to you that in order to make this a very, very simple presentation for our audience, Dr. Gabula has in fact planned a number of slides which she will share with you from time to time in order to help explain the aspect that needs to be told to you. These will be uploaded by our control rooms manned by Ian and Aubrey. As and when required, Dr. Gabula will request the control rooms to put up these slides. I can tell you she's got so many of them all ready for any kind of questions. So there you are, Dr. Gabula. Please feel free to call upon our control room to upload the slides if and when required at any point in time based on what you're really wanting to explain. Ladies and gentlemen, it's time to trade our focus on a very enlightening session coming up now. Firstly, Thank you, Dr. Gabula, for giving us your valuable time to share with us deeper insights on a complex illness, more particularly amongst our women folk. Let's dive straight into the discussion right now. We are all aware, Dr. Gabula, that October is meant to be Cancer Awareness Month. And this is demarcated across the world. As a background, is there any specific reason why October is earmarked as a month of breast cancer, doctor? Is there something significant about October? How did all of this come about?
Good morning, and thank you for inviting me today to your August forum to give a talk on this topic and share my knowledge about breast cancer. I thank you, Yvette, for such a warm welcome. Thank you, Sanju, for the introduction and the question. Coming to the question, yes. Before I start, let me tell you, this is a topic which is very close to my heart. I am very passionate about it. I hope I can infuse a lot of you with my passion for creating awareness about this disease so that you may share it forwards. Now, coming to the topic, yes, breast cancer and October. It was way back in 1985 that the American Cancer Society decided to name October as the month for breast cancer awareness. Besides breast cancer awareness, they also initiated the program whereby mammography was supposed to be done as a routine for identifying breast cancer as a screening method. That was how it began. But it was much later. Sorry, I'm very sorry about that. In 1993, it was the Estee Lauder Foundation, which started the Breast Cancer Research Foundation, and when they picked up the pink ribbon and they made that the symbol of breast cancer awareness. And that's when it has become the sign of breast cancer. Now, why is it important that breast cancer awareness is so significant? That we will come to in a minute, right? It was begun much earlier by Susan Komen's sister, Helen Komen. What did she do? Susan Komen died at the age of 36, very young, because breast cancer is a disease of older women, right? That's how we all know it. But this young lady died at the age of 36. And her sister decided that she is going to take steps to find out why and eradicate breast cancer. So she initiated the Susan Komen Foundation, Breast Cancer Research Foundation, way back in 1982. And since then, there has been a lot of people working towards breast cancer research. And the whole concept of this awareness month is not only awareness. One is awareness, of course, because it is a problem. And two is for research, because there has to be funding. There is money required. And that money is what is with people come up and, sponsor various programs and things, which is why there is so much of treatment available for breast cancer today, and it is being tackled in a better way.
Sure. So Dr. Gabula, the very fact the world has decided to earmark October as a breast cancer awareness month, it's quite evident that there's something serious that needs to be done. Can you tell me, why is the world giving so much of attention to breast cancer? Is it now becoming increasingly a more serious issue compared to the past? Or, it always was a serious issue. Why is the world giving so much of importance to breast cancer?
Yes, Sanju, that is the crux. It is not going away with all the research, with everything, with all the awareness. breast cancer is still, can we have, excuse me, Ian, can we have the slide on the pie chart, please? Thank you. So if we look at this pie chart, of course, pink is the breast cancer. This is with an estimated number of new cases in 2020 across the world. Pink, of course, represents breast cancer, as I repeated. Gray represents a lot of other cancers mixed together. Singular cancer is breast, and it is about 1/4 of all the cancers that are occurring in women in the world, right? So
Sure.
this is why it is important. Now, the breast cancer occurring by itself is okay, right? It's a problem. But
Sure.
the next slide, if you can please put, it tells us about the number of deaths with breast cancer. Besides being the #1 cancer in women across the world, it is also the #1 cancer causing the most deaths. Now, that is important because even with the awareness and everything, we have to catch it. Why are there deaths due to cancer, breast cancer? They are not due to the primary cancer. They are due to the spread of the cancer. When the cancer spreads, when it goes to important organs like the brain, the liver, the lungs, the bones, life is damaged, life is hampered, and death happens. So that is why it is given so much more importance. It has to be tackled.
Sure. Doctor, thank you for giving us a world perspective on breast cancer. If we came closer home, how does India compare to the rest of the world? Is it that India is better off? Are we worse off? Or are we as bad as the rest of the world? How does India compare to the rest of the world? If you could give us a more closer home perspective, please.
Absolutely. So in India, what we find that every 4 minutes, one woman is diagnosed with breast cancer. Every 8 minutes, there is one death due to breast cancer.
Oh.
Right? Can we have that next slide on Indian breast cancer, please? Thank you. So in this, we see in the 2020, which we saw for the world was 25%. In India, we are seeing a 38%.
Wow.
So India has much more of the breast cancer happening. Of course, it is more in the urban areas, less in the rural areas, because that's the way it is. The environment also plays a role, which we will come to later. But this is the incidence of breast cancer in India today. Besides, if we look at the next slide, please, thank you. The incidence between women, young and old, it has been assumed, it has been classically a disease of older women. But with this chart, we see the younger age group is now having more cases. Can you appreciate? It is about much more in the 25 to 49 as compared to the older age group. So yes, breast cancer is important in India, and our awareness is not so much. In the Western countries, they have been working on this. They have been spreading awareness. There has been a lot of talks, everything goes on. In India, we still have to get there. Yeah.
Oh, well, Doctor, I mean, those were two eye-opener statements that you made. The first one is that breast cancer is becoming more and more rampant in India itself. And the second one is that it's even now spreading to the younger generation. The thought all along has always been, that it's probably the older generation that's more infected. Interesting, very interesting. Dr. Gabula, can you share with us who can get breast cancer? Can anyone on the face of this earth just be infected with breast cancer? Is it limited? Is it restricted to a certain segment and things like that? Who exactly can get breast cancer?
So yes, we understand that breast cancer is a disease of women. But guess what? Men also have breasts, right? And they can get breast cancer. It is a very small percentage of men that will get breast cancer, 1%, right? But the awareness is important. again, because if you don't know that you can get breast cancer, you can have a problem, you will get it treated, and if it doesn't resolve, you will struggle with it, right? Similarly, for the young women, what happens is they get treated and they say, no, this can't be cancer. So you keep on, doing something or the other. By the time it has spread, it has gone to the next level. And that's when the problems get multiplied, and death is not so far away there. So it is important to be aware. So men can get breast cancer, though it's a small amount. The women, we discussed the age groups. Besides this, we have the women, the pregnant and lactating women. They are also prone to getting breast cancer. Now, in this age group, if there's a cancer that's going to happen, the most common one is breast cancer. In lactating women, the ones who are breastfeeding, most common is called lactation mastitis. It happens due to the ducts getting blocked, right? And therefore there is some swelling, inflammation, sometimes an abscess develops, and treatment is taken. What has to be understood is that, yes, you have to do what the doctor says and get the treatment taken. If after a few weeks, like 2 weeks, 3 weeks, and you have done the entire course of treatment with the antibiotics and the hot massages and everything, if there is no relief, it has to be checked out for breast cancer. So this is also important to remember.
I see. Interesting, doctor. Sorry, you were going to say something else?
No.
Yeah. So Dr. Gabula, can you give us some insights into what really causes breast cancer to begin with? And I'm asking you this question more against the background of us having experienced COVID these days. With the advent of COVID, there's so much of consciousness of which diseases are contagious and which are infectious and things like that. So what causes breast cancer? And more importantly, is breast cancer contagious? One. The second thing is, if it is contagious or infectious, is something that you can open our eyes to. Can it also be prevented in some way or the other, doctor?
Yes, very, very good question. Very good question, Sanju, because guess what? We are in this time, COVID time, right? And there are so many diseases that are rampant, which are infectious. Breast cancer is not one of those. It is not, cannot be transmitted by a parasite like typhoid or tuberculosis, or COVID, for example, or dengue. Yes, some cancers have a relationship with viruses. For example, the cervical cancer, which is related to the human papillovirus, right? But breast cancer has not yet been connected to any virus. No connection has been detected. When we move there, from there we come to, okay, so that is not the cause. Then what is the cause? We know, with all that research that has been going on, we are aware that the cancer cells are abnormal. Now, why are these cancer cells abnormal? These are cells which have mutated. The genetic material has changed. They have abnormal material in the genes, right? Now, when these abnormal genetic containing cells proliferate, when they get the right environment to grow, that's when they will grow uninhibited. If we can have a look at the normal cells, please. Ian, the slide with the normal cells. So these are normal cells. They are present all over our body, in all our different organs, and they will function according to the requirement of the body. They will multiply, divide, and they will die. When the body requires that this cell is now old, it will destroy it. New cells will take their place. What happens in cancer cells? Can we have the next slide, please? Ian, thank you. These are rogue cells. These are angry cells. These are cells which don't listen. They don't follow the rule. They decide to break out and do their own thing. And what do? They just grow uncontrolled. When they grow uncontrolled, initially, of course, they'll be small. It'll be a small clump, right? And if the body is unable to contain it, then they will grow. When it is small, it will be painless. It will not do any harm. It will not be having any symptoms. You won't have any feeling about it, right? But once it grows, it will impinge on the normal tissue surrounding. When it impinges on the normal tissue, it will cause pressure. That pressure may cause some discomfort. If it affects a nerve, it will cause pain. That's when there will be pain. When it gets into a blood vessel, it gets to a lymphatic, it will get taken away to distant organs and tissues. If it goes to the brain, it goes to the lungs, it goes to the liver, bones. This is where breast cancer cells mostly go. That's when the disease spreads and it can get worse. Now, like I said, these abnormal cells, we don't know why they become abnormal, right? That's the one problem which we don't know. But we do know that there are certain predisposing factors that have been identified. Now, having these predisposing factors doesn't necessarily mean you're going to get breast cancer,
Sure.
but they will increase the risk of developing breast cancer. So if we can just have a look at that slide, please, the next slide about predisposing factors. Correct. Thank you so much, Ian. This can be divided into two groups. One, the ones that cannot be controlled, and the ones that can be controlled. Now, of course, the first one that cannot be controlled is being a woman. The risk is higher, of course, right? Now, the next thing is having physical ailments like diabetes or hypertension. Now, if a lady has these conditions, the predisposing, it is predisposing. It can aggravate, if the cells are lying there and they are dormant, and then you have diabetes and hypertension, they will find an area to grow, right? So these are conditions which you can't do anything about. You have to treat it and you have to maintain your health.
Right.
There is maternal family history. Now, this is important. It has to be on the maternal side. Sanju, you understand the importance of this. It is not the paternal. It is on the mother side. So if your mother, your grandmother on the maternal side, your aunts on the maternal side, if these people, if any of them have had breast cancer, the risk for breast cancer development in a person is increased.
Oh,
by how much? Yes. But it is not so much. How much is it, you'll ask? 5% if one person is infected. It's 5%, right? And if 2 or more people, then it will become 13.8%. These are calculations done by research done in the Western countries. We are following whatever they have done. We have not got information of our own. But this is pretty much applicable across the world, right?
Sure.
So that's the maternal family history. Then we come to the BRCA genes. Now, I'm sure you've heard of these, right? Everybody's heard of Angelina Jolie and the BRCA genes. Now, let me tell you, all of us have BRCA genes. These are good genes. These are genes that will fight the tumor cells. They will destroy them. They will will not let them grow. But when they become abnormal, that's when the problem arises. When they are mutated means they are changed, right? They can be changed due to various factors, and that I will tell you in a minute. So once that BRCA gene is abnormal, then it cannot fight that tumor cell. It cannot fight that cancer cell. That's when the cancer can grow. So now, having the BRCA 1 or 2 genes increases the risk of developing breast cancer a little significantly. 50 to 80% is the chance if you have a BRCA 1 or 2 gene in your genetic makeup. So right now, how can you get this abnormal gene? One is by inheriting from your mother or your father. Both can have an abnormal gene. And if either one has one, you are 50% chance of getting it, right? Now, besides that, what happens? The other aspect, the gene can get mutated in a person during life. There are various factors which can cause mutation of the genes, such as external environmental factors, which we will come to in a minute, right?
Right.
So now, besides the breast cancer being caused by these BRCA1 or 2 genes, ovarian cancer risk also increases, pancreatic cancer and prostatic cancer. Okay, so that's fine. Now we come to the external environmental factors. External environmental factors, again, sorry, they are factors which can be controlled. When we come to the factors which can be controlled, can be divided into external and internal environmental factors. Correct?
Okay.
Now,
Okay.
So in the external environmental factors, 2 have been identified. One is radiation and the other is hormones. When I talk about radiations and hormones, what do I mean by that? One moment. I don't know what happened. Yeah. When I talk about radiation, what do you mean by radiation? I'm not talking about, the radiation of bombs and stuff like that. No, day-to-day,
Sure.
medical
Right.
radiation. We have a habit of going for X-rays and getting them done indiscriminately. Unless there is an indication and there is going to be a change in the medication with that report of the X-ray, avoid. Because these are factors which will damage your environment. It is known to cause damage. We take X-ray, X-ray chest, like, let's just go get an X-ray. No, I think I've got a cough. I got to check this out. Let me go get an X-ray. Let me get an X-ray of my knee. No, that's hurting. No, unless a doctor is advising and that there is a reason for it, please avoid doing that, right?
Sure.
So that is the radiation. Another aspect of radiation is the mammography. So earlier they advised mammography routinely after the age of 40 in all women every year, because mammography is the gold standard for diagnosing breast cancer in the early stages, right? That is a known fact.
Right.
But it also adds to the radiation dose which you get. So once they understood that, they've pushed that to the next level, which is 45. At the age of 45, they advise doing a mammography. And with that mammography, it can be done depending whether the doctor indicates it, and every second year if necessary, depending on the patient history, family history, etc.
So, doctor, the mammography would require to be done irrespective, right, of whether you suspect something or not. Is that what you're saying? So
that's what was advised earlier.
Okay.
That, at the age of 40 or 45, now they say 45, do one baseline mammo to know how your body is working and functioning, and then take it forward. But it is now questionable, and if there is indication, you do it. You don't. It has to be studied. In conjunction with your doctor, you have to think about it. If necessary, please go ahead and do it. And one baseline mammo is okay, because that gives you an idea of where you are, and then you can take it forward.
Sure.
So the other thing with mammography is now there are better and more advanced methods available. There is 3D tomography and etc., which are reducing the radiation given to the patient. But these are not available everywhere. In the mofussil areas, it is not everywhere. So you have to be practical about this and work it out about how is it required.
Sure.
Right?
Sure.
So then we come to hormones. What are hormones? Why are we talking about hormones here? So these are hormones which occur normally in a woman's body. Estrogen, progesterone. Estrogen is the one that is like the rogue, they say. It is good, it is necessary, it is very essential for women, but it is also the one which stimulates and promotes growth of cancer. So what happens is, if you have an early menarche, this is something you can't do anything about, early menses, and you have a late menopause. That means estrogen lies in your body for a long period of time. If you have late pregnancy, and then don't breastfeed, again, the levels of estrogen in the blood are staying on for a longer time. This is conducive to promoting breast cancer if there are chances. So that's why, there has been advice to have babies early, breastfeed, etc. It helps the mother as well. The second thing is, women nowadays have a lot of issues in the sense that there is PCOD, there is infertility, medications are taken for these things, and these are EP, mostly hormones. Now, judicious use of these medications is advisable, but indiscriminate use is not. Continuous use of these drugs is not advisable. What happens is people go from, this is a condition, which is not like a short term, like you've had fever, you've had the medicine, you're not done. No, unless there's a pregnancy that's happening and you're struggling with infertility, you go from one doctor to the next. You don't tell the second doctor that the first doctor has given me this medication. So the second doctor will start. How do they know? And
Absolutely.
then you will continue. That's what I'm trying to drive here, that you have to be aware and informed, and then share accordingly with your doctor what your situation is, and then take the informed decision about taking medication.
Doc, you've raised so many valid points in this last question itself. In fact, the first one is that it's really very comforting, all right, to know that it's not infectious. I know of a lot of people who really try and avoid cancer patients simply because there is some kind of a myth to say that it could be contagious. Very comforting that you're telling our listeners that it's not contagious. The other very important point that you made is about the mothers. Breastfeeding does not just help the child, but helps the mother as well, particularly in a very, very fast-moving city like Mumbai, where people rush off to work. Mothers may be reluctant to breastfeed. Very, very insightful thoughts. Thank you so much. Doctor, can you share with us, are there any... Sure.
One moment.
Sure.
There are certain more factors which we have to talk about, the internal environmental factors.
Okay.
So when we talk about the internal environmental factors, this is the tissue, the area around the cells. Now, these abnormal cells, if they get stimulation, or they are getting the non-stimulation, then they will proliferate. So for that, they advise things like, what is general, right? It is a general method, which is a healthy method. So reduce your weight, keep the weight down, reduce the alcohol intake, reduce red meat intake, reduce processed foods, and do regular exercise. This should be maintained because it is important that you live healthy. What happens as you grow older, the estrogen percentage will drop in your blood, right? But and with menopause, there is the estrogen stops. Ovaries are the ones that produce the estrogen. Once the menopause happens, estrogen production is stopped. So then, but the woman needs estrogen. So the body does its own function. How does it do this? It takes the fat cells, and there are certain hormones in the fat cells which are converted into estrogen. And then the body can have some amount of estrogen, less of course, but still it's there. So this is why they advise that control your weight, keep it down, especially after menopause. Keep your weight down. It will help to prevent breast cancer. Yeah.
Wow, very interesting, Doctor. Really very interesting. Doctor, can you give us some insights about ways to detect breast cancer early? Are there any steps that our ladies can really take to detect breast cancer at a very early stage? More than often, we ignore it and tend to realize what's happening much later. But what are those early steps that one can take to detect breast cancer early? Can you share some thoughts on that, please?
Just a moment. Can we take the slide off, please? Thank you. Give me just a second, yes.
What do you want, some slide to be put up again, or?
No, I was just, yes, that was it. I was just wondering. Yeah. Okay.
Okay, so steps,
yeah,
doctor, to detect, yes.
to detect breast cancer.
Yeah.
WHO, realizing the issues that that this is causing, they have laid down a set of guidelines.
Okay.
Which we can follow. Basic concept is we should start at the age of 20, because it can happen to any woman starting from the age of 20, right?
Wow, so, as early as 20, is that what you're saying?
Yes. It is,
okay.
That is how it has been identified now. So,
right.
Because of that, we see that breast cancer, so we start at the age of 20. There should be a breast self-examination done by a woman every month. Breast self-examination is something I will talk about in a minute. And then an annual health checkup, an annual breast health checkup. This should be done by qualified personnel. After the age of 45, like I said, we should get a mammography as indicated. Then, so what do you do actually? I mean, yeah, you said, I mean, like WHO had said, let's do this, right? How do we go about it? The first step is to know that a problem can occur. Then to know what to look for, right? Follow that up. Keep a watchful eye on ourselves by doing regular breast self-examination. Know what steps, if you find something abnormal, what should you do? And then do that. Our women, everywhere actually, but in India especially, what happens is we feel inhibited. We feel, a little hesitant to approach doctors about something that is so personal, which is why we have the breast self-examination to start with. Let us begin with the early signs of breast cancer. Come, we'll talk about what we can look for. And can we have that slide up, please, Ian? Thank you. So these are, everybody's heard of them, but let me go through them for a minute. The most common and the common one that everybody knows about is the lump, right? Everybody knows that a lump means breast cancer. Right. But where in the breast? It can be the entire area of the breast, right from under the collarbone to under the breast, from axilla, from the armpit to all the way to the breastbone in the middle. It is important that in all of this area, if there is any lump that is found, we have to keep an eye out and think that it could be something suspicious and we have to take care of it. Then we look at the skin, the nipple. So the nipple is normally everted. If you understand what I mean, normal nipples are everted. Some women will have inverted nipples, but not all. Now, if you have an inverted nipple to begin with, that's fine. But if you have an everted nipple and that turns inwards, that's when the question arises and a red flag is raised, which you need to get checked up. Discharge from the nipple. Discharge from the nipple is a normal occurrence sometimes. They can have brown discharge, green discharge, bilaterally, blue, milky discharge because of prolactin, etc. But when it is a unilateral, one-sided discharge and it is bloody, that's when the red flag gets raised. It needs to be evaluated. Looking at the size of the breast may be asymmetrical in some women, which may be perfectly normal for that person. But sometimes you notice that your breast is increasing in size. That can be a really early sign. Without a lump, without anything else, just the increase in size of the breast can be indicative of early breast cancer.
Okay.
Surface of the breast, the skin of the breast. If there is dimpling, if there is puckering, if there is, the veins are showing up, if there's redness, if there's an orange peel appearance, which cannot be explained. Like some women, sometimes they have, you change a bra, you have some certain powders, you use certain creams, and that can cause an allergy and a rash. Yes. So you have to understand that if that is the cause, and if that can be treated and it's fine, but if that persists and lasts over a period of time, then you need to get it evaluated, because there are certain cancers which will just appear as a skin condition. And that's called inflammatory breast cancer. And it just you get the redness of the skin and the breast, and there is no lump, nothing. And you keep treating it for some inflammation, but it's IBC. So this is why my topic is breast cancer awareness. We talk about the awareness of this.
Right.
And the lymph nodes, like I said, because the lymph nodes will be basically lumps in the armpit. Right. So this is what changes that we can look for. Okay. Yeah. Then one moment. It's back to you, Sanju.
Yep. Would you want the slide to be taken off, Doc?
Yes, please. Yes, please.
Okay. Thank you. Doctor, are there some methods for our women to really keep a check on themselves to understand if they are now heading for breast cancer? Obviously our women cannot run to a doctor every day, right, just to find out, oh, do I have this kind of a problem coming? But are there some methods which she can self, try and investigate, some way of finding out whether she's heading the wrong way?
Absolutely. This is where breast self-examination comes in.
Sure.
Breast self-examination is examination of the breast by the woman herself in the privacy of her own home. It should be done every month. There are a few, it's a protocol which has been established and which has been described, and a lot of people are aware of it. There are videos, there's everything aware, there's a lot of awareness of it. But do people do it? Not many women. Not even educated women, not women who have had it in their families. It is not happening. Take case in point myself. I was aware. I had family history. I had an aunt who passed of breast cancer. And I had lumpy breasts. I used to get regular checkups. I used to go to my doctor. I used to do my breast self-exam. I used to do my mammograms annually, everything. At the age of 57, for a couple of months, I was lax. I did not do my BSE. I missed my mammogram appointment.
When you say BSE, what do you mean by BSE, doctor?
Breast self-examination.
Okay, all right, okay, yeah.
So yeah, it's addressed as breast. So I missed that, and one fine day, I find a nice hard lump. It was the size of a marble, and there were lymph nodes. And yeah, that's when it struck me that, see, if I could miss something like this, breast cancer is not something which you can prevent. It is not something that you can, let's start with that premise. We can catch it early. We can do all those things which I just mentioned, predisposing factors, etc. But if you're going to get it, you're going to get it. But the idea is to catch it early. If you catch it early, you treat it early, you are good for life. Because 95% up is the survival for breast cancer first 5 years, 100%, 95 to 100%. So if you catch it early, your 5-year survival is superb. Right. If it's later, then you are taking a lot of medications. You have to do the whole rigmarole, So why not catch it early and treat yourself?
Sure.
So that's when it struck me that if it can happen to me, it can happen to everybody. Once it got confirmed, I actually sat down on my phone and I called up all my cousins, all my friends, and I said, please get yourself checked. I mean, the ones who were my age, the 50s and odd, please go get a mammo, get a baseline mammo, right? Get yourself checked, do the BSE. And I decided that this is something I'm going to do. And once I got done with the breast, the brain fog and everything, it took time to get out. I started this program, BSE for Life, where BSE stands for breast self-examination, right, for life and for your life. So yeah, so that's where I've gone into this. So now, so talking about breast self-examination, coming back to the topic, it is something that I have to tell you.
Sure.
So it should be done at the same time every month. Now, why at the same time every month is the question that arises. Because breasts are hormonally dependent. You know, they have ducts and lobules and they change according to the hormone changes in the body. So if you do it at the same time every month, you will have the same feeling. So if there is a change, you will notice it. Usually it's advised if you're menstruating to do it around the 4th or 5th day of the cycle, because some women tend to have tender breasts, and then that by that time the tenderness has gone off, so it works. If you're menopausal or for whatever reason you have stopped menstruating, then what do you do? So you pick a day of the month. You take the 1st, you take the 15th, and then you do it on that day. It's not a very long procedure and it's not very complicated, right? You can do it in the privacy of your own home, in the comfort of your own home. You don't have to ask anybody's permission. You don't have to pay anybody anything. It's something that you do for yourself.
Sure.
And the advantage is you get to know your body. You know how your body is. By doing it every month, you know how your body is, how the structure is. Then if there is any kind of change, you will pick it up immediately. So there are 2 steps to it. And if we can have the first slide, please. Oh, I'm sorry. I didn't go through this lot. No, these were the changes that you look for. Okay, I'll go quickly through these. So the changes that you look for in the breast, the lump, the swelling of the breast, the lump in the armpit. Next slide, please. Discharge from the nipple, inversion of the nipple, and rash or irritation of the nipple, right? And then the next slide, please. These are little graphics, so I was not sure whether I would show it to them, but yeah. And then there's the dimpling and skin rash and male breasts. Males have to keep an eye on themselves as well, right?
Right.
Okay. And then thank you so much, Ian. Next slide, please. And that brings us to the breast self-examination. There are 2 steps to this procedure. The first part is to look. So you stand in front of a mirror and look at yourself. Of course, you have to be undressed and looking at yourself. So closely, 3 positions, one with arms at your side, one's with arms at your raised above your head, and third is arms on your hips, leaning forwards. In all 3 positions, look at yourself from the front and from both sides. This is in this way what you identify if there is any lump, if there is any change in the size, if there's any change in the skin, if there's any nipple discharge, right? Why are these different positions? Because if there is a lump which is lying on the underside of the breast, when your arms are raised, it will come out. If there is a lump in the armpit area, putting on the arms on the shoulder and leaning forward will help to bring it out. Besides, if there is a deep-seated lump, it will be brought forward. So this is important to do. Once you've done this, then you need to lie down. Can we have the next slide, please? Right. Now, this procedure is very simple. You need to lie down. If you're going to examine the right breast, you lie down with a slight tilt towards the left, put a little cushion below your right shoulder, put your right arm above your head with the 3 fingers of the left hand. Use the pads of the fingers, not the tips. Pressure is applied in 3 levels. One is deep, one is slight, and one is very light. Okay, so by this, what we do is we identify if there is any kind of lump at any depth. The lump can be superficial or deep or middle size. So by applying these different kinds of pressures, we can pick up a lump at any depth. This direction of movement is circular, and it can go from the under the collarbone. Like I said, it has to be cover the whole area of the breast. So you go from under the collarbone all the way down to under the breast, from the armpit all the way to the breastbone. Around the mid-nipple, you go in a circular fashion. Okay, so in this way, try to avoid lifting the hand off the breast at any point, because you don't miss any area, right?
Sure.
Now, this we can just, and then you repeat it on the other side, right? And
Sure.
we can see this in a slide video format. If we can just show that, please, Ian. Yeah. The same thing is explained by this doctor.
Hi,
very
I'm
well.
Dr. Laura Cooper, one of the breast surgeons at City of Hope. Today I'm going to talk to you about self-breast examination. Around 8 out of 10 women detect breast cancers or breast lumps themselves. Therefore, it's important that every woman understand the basics of a self-breast examination. There are actually two components, look and feel. For the first part of the exam, looking, you want to stand or sit in front of a mirror. With your clothes off, you want to look at both breasts to see if there are any differences between the two. Examine the nipples to see if there's any difference between the two. Is one redder than the other? Is one pulling in? Then you want to put your hands on your hips and turn from side to side to see if there are any changes. While standing, you actually want to put your arms forward on your hips because this will bring out lumps that might not appear otherwise. It's important to raise both arms above the head. This will draw out any puckering or dimpling for masses that might be underneath the nipple. If you're standing like this and you have a mass that's kind of in the lower part, you might not see it at all. But when you raise your arms, what happens is that mass kind of stays and then the skin kind of pulls in as you're pulling up. That was the first part of the examination. For the second part, you want to be lying down. You want to put your head on a pillow to prop yourself up and place one arm behind your head. Then with your other hand, you want to use your first 3 fingers. When you use only 1 finger or 2 fingers, you can actually separate the breast tissue and think that you feel something that isn't there. You can do this one of 2 ways. You can either go in a circular motion all the way around the breast, making sure that you overlap every area, or you can go up, down, all the way across. I prefer the circular motion, from the collarbone to the sternum or mid-chest, below the breast, and then all the way actually out into the underarm. Lymph nodes are underneath the underarm, and sometimes those can become bigger. When you're doing the breast examination, you're looking for things that feel different from the surrounding tissue. What you're looking for is something that stands out, something that feels like a pea or a marble or a walnut. You want to make sure that you do this examination at the same time each month. Remember, the most important thing about a breast self-examination is to know your breast. That way you can note any changes and alert your doctor.
Thank you. Thank you. So as she said, thank you. We can take the slide off. So as Dr. Laura said, 8 out of 10 cases are picked up by women themselves, but it's usually in the later stages. So the idea is to catch it early. Also, 80% of the lumps that will be found will be non-cancerous. Only 20% will be cancer. But considering the incidence being so high, do you want to be in that 20%? So
Sure.
It's important to get it checked out. So that, yeah.
Thank you, doctor. That was very useful. In fact, one can self-examine yourself and know whether you're heading the wrong way. Very, very useful, I must admit. Now, doctor, just in case we do find that there is a problem through the self-examination, one does identify that there is a problem, or you see some kind of symptoms, all right, which are suspicious or suspect. What steps does one take next to convert that suspicion into finding out whether you're really infected or not? Are there any guidelines that you can provide to us, please?
Yeah. So this is the next step, which is equally important, which in India we have to actually work on. Because if you find something suspicious, you have to approach your doctor. The first step is approaching your family physician. Usually that's the person you're most comfortable with, right? When you go to your doctor, please say that this is the problem I've come for. Don't hide this problem under any other. I have a cough, I have a cold. Oh, I also have a lump. No, that is not the attitude. You go with, I have this lump. Please help me here. Let me get me checked out. That is important. You have to give it the priority, the importance that it deserves. If you find that the doctor is not giving the due importance that you want, you are totally valid in asking for a second opinion, approaching somebody else until you are convinced. Like I said, 80% will not be cancer, but 20% will. I know of a patient, a young girl, right? And she had a lump. She went to the doctor. The doctor said, this is nothing, go away. Don't do anything about it. This girl went away. After a year, this lump increased in size. And this is a true story. It increased in size and it started paining her. She was getting married. She went back. Luckily for her, that doctor was on leave. The other doctor who was in place said, this is not acceptable. Please, let's get a mammo. Let's get an ultrasound. Do the next check. And that was cancer. She had to go through the whole rigmarole. So it is important that we give it due importance. Now, you go to the doctor says, yes. Suppose the doctor says, yes, this is suspicious. Or the doctor says, no, it's not suspicious, and you're convinced about it, go back home, watch it. And if you feel that this is not getting better or it's getting worse, you go back. If your doctor feels that this is a problem and which you have to evaluate, then what do? They will advise you to do a next thing, which is a sonography, right?
Okay.
This will be followed by a mammography. And then if there's still suspicion, it will go to a biopsy. The biopsy and the diagnosis of cancer is only based on a biopsy. Only after that pathology examination result comes in, can you say for sure that this is cancer or not. So let's just go through a little bit of what is sonography. I'm sure everybody is aware, but just a bit.
Sure.
Can we have that first slide, please? Thank you. Right. So what is sonography? Ultrasound examination. Basically, it's ultrasound waves, sound waves. So it is not harmful. It is not painful. And it can be done in all women, even pregnant women, and in the childbearing age. So that is not an issue, right? The advantages of sonography, it can pick up a cyst. If there's a cyst and a solid tumor, to differentiate between the two, sonography is the gold standard, you could say. And it can differentiate between the two. Let's look at a couple of examples. Can we see the next slide, please? In this, of course, it's just to give you an idea. A cyst has fluid in it, so it will look black on ultrasound. That's the first picture. The second one is a fibroadenoma, which is a simple tumor which happens commonly in women, young women. Cysts usually happen in older women, menopausal, while fibroadenomas will happen in younger women and teenagers and as they grow. So this is a very classical picture of a fibroadenoma. They have a well-defined outline. Cancer has a very irregular outline. It will be, again, just very irregular. Calcifications in cancer are not very easily picked up in ultrasound, early calcifications. And glandular tissue is echogenic. Now, what is important here is that there was something I wanted to tell you. I don't know where that went. Anyway, as it comes to me, I will tell you. Can we have the next slide, please? So here we again come back. So these are normal. This is a fibroadenoma, the simple cyst, and a normal lymph node. Lymph nodes will appear like this normally. And when they have an echogenic center, this center part, then that shows it is a normal lymph node. Next slide. This is a complex. So these are complex films where there are complex pictures. There's cyst with fluid inside. When there is a mass inside, that's when the question arises whether this is cancer or not. And the cancer itself, and then the abnormal lymph nodes. Yes, what I wanted to tell you was cancer grows rapidly and unconditionally, right? So the growth is in a dendrite. It will spread out. It will not have a smooth outline. Like if there's a benign mass, it will grow smoothly and it will have a smooth outline and it will have a border which will be well defined. Cancer won't. So that is another difference which I wanted to point out to you. Yeah. So we come to the next one, which is, please, can we have the next slide, please? Thank you. So we come to mammograms. Now, mammograms are gold standards in picking up very early cancer.
Okay.
Microcalcifications are picked up very early in a mammogram. Of course, it involves radiation and it cannot be done in pregnant women. And there are some other disadvantages. It cannot distinguish between cysts and solid masses. But what happens is these cancers usually found in older women, right? So by the time, can we have the next slide? So this is the appearance of the breast, a normal breast, right? So in an older woman, you will have the fatty breast, the one on the left-hand side. And in the younger woman, there will be a lot of breast tissue, the ducts and lobules, so it will be dense breasts. So as you can see, and cancer is white, it's dense. So if it is found, if there's a cancer in a younger patient, it can get hidden within the breast tissue in the X-ray, right? While in the older age group, it can be picked up easily. Calcifications also might get hidden, while it will not be in the older. So that's why the advantages of mammography are there, and there are advantages to sonography. Coming to the next slide, please. We'll just show the microcalcifications. They are very tiny calcifications and they have a very typical appearance. Of course, the doctors will be able to tell you whether this calcification is cancerous, or you can have cancer calcifications in benign conditions as well, right? Then we come to biopsies. Biopsies are done under ultrasound guidance. Can we have the next slide, please? And then that is done. So by that, a needle is inserted under local anesthesia, and the tissue is taken out, and that is studied. The tissue will, the report will tell us what is the type of the cancer, the grade of the cancer, how aggressive it is, and whether they will do tests to find out whether it is hormone dependent or HER2 positive, etc. So all these things will be assessed in the biopsy. Only after that will treatment be taken. Can we go to the next slide, please? So that brings us to the treatment of breast cancer. Yeah.
Want to take this off the slide?
Yes,
take
please.
the slide off?
Yes, thank you.
Doctor, so far we've gone through this process of really, self-examination, that leading on to finding some symptoms, the symptoms then trying to indicate to us what steps need to be taken. All of this is fine. Let's assume now for a moment that one does find that the cancer is confirmed, all right? It is medically confirmed. Once it is medically confirmed, all right, is there any specific procedure that one needs to follow? It's now confirmed, it's there, medically it's proven. What does one do next?
Yeah. So basically the treatment of cancer is, there's a team of doctors that work together. There's an oncologist, there's an oncosurgeon, there's a radiation specialist, and then of course there's the whole support staff, right? So once the diagnosis is reached, these doctors will sit down together and analyze how to best treat this condition for this specific patient. There are basically 4 pillars of treatment. If we can have that slide now, please. The first one, it tells us, first is, there are 4 pillars. One is surgical treatment, by which we can do a lumpectomy or a mastectomy, depending on how it is indicated. Suppose the mass is small, the doctors may feel that it is necessary just to remove that much, and that is enough. You don't need to go through a mastectomy. Usually what is removed is, along with that, lymph nodes are removed. So to know whether there is any kind of spread is called sentinel lymph node biopsy is done along with that. And if there is, and they do it on the table, and if they find that there is any cancer there, then accordingly they will adjust the surgery. So even on the table, sometimes there is decisions are changed depending on from patient to patient and the case as it is. Chemotherapy is the next line of treatment. Now, not necessarily the next line. It can be done before, during, and after. Before and after the surgery, right? When it is done before, it is called neoadjuvant. If it is done after the surgery, it is called adjuvant. Some other treatments are given which are called biological or targeted therapy. These are newer treatments, these specifically target cancer cells, and therefore they are less harmful to normal cells. See, chemotherapy basically kills cancer cells. So it is very aggressive. It will also damage normal cells, which is why there is loss of hair. There is loss of, the skin problems, the nails, everything. There are a lot of issues which happen when you are undergoing chemotherapy. Of course, there is a lot of improvement. There's a lot of advances made. So it is much better now. And a lot of medications are given in order to prevent the side effects.
Sure.
But whatever it is, it is. Hormone therapy is another way which is used nowadays to tackle these conditions. Following all this, radiation therapy is given. Again, this is a case-to-case basis. So what happens with radiation? Once you've taken out whatever cancer is there by the surgery and you've killed whatever is left with the chemotherapy, then radiation is given in order to nullify any remnants of cancer in the body. After this, still, maintenance therapy is given. Depending on each case, it can be given for 5 years, 10 years, and follow-ups are done. One more thing which people do is a PET scan. So this PET scan is done at some point, maybe before the surgery or after, depending on each the protocol each doctor follows. Why this PET scan, what is assessed is if there is any kind of spread anywhere else in the body. It is, of course, radiation involved. So judgment is made according to necessity. But this will let us know if there is cancer anywhere else in the body and what steps to be taken in further. Yeah. Yes.
Right.
And we can take this.
We take the slide off. Yes.
Yes, please.
Doctor, before I can pose one last question to you before we get on to the audience, I'd just like to request our audience, if any one of you have any questions, please go ahead and post your questions on the YouTube chat group. We will be happy to place this before Dr. Gabula, and she will be most delighted to answer any question that you may have. Doctor, if I may, one last question to you. We've talked about various things right now, right from the symptoms down to what really one needs to do when it is detected, down to confirmed cancer. But are there any common problems of the breast, all right, which actually mimic the breast cancer? And how does one identify them? Sometimes it's so confusing for our women to really know what really is mimicking breast cancer, with what is it. Any common problem that you would like to share with our audience, please?
Yes, certainly. This is very important, Sanju, because that's where it starts, right? You don't know what is this, where is this going. We have a list. If you can put that up, please, Ian. Thank you. So these are the common ones: pain, lump, problems in the skin, nipple, and nipple discharge. The first one is pain, right? Now, this pain in the breast is a very common problem. A lot of women have it. This pain can be of two types. It can be cyclical or non-cyclical. What do I mean by that? Cyclical pain comes every month. It comes almost like, with the clockwork regularity, comes before the periods and then it passes off after the periods. Usually it affects both the breasts and there is swelling, tenderness, etc. But often people get confused. So if you want to keep a track and figure out what exactly is this pain, one hack is, mark on the calendar for a month or two the days when the pain occurs. if you watch it and you follow it after a month or two, you will see that, oh, this pain is happening every day. Oh, it's just happening in these few days. And once you know that, okay, so this is cyclical and I don't have to worry about it. Oh, this is not stopping, and then I need to get it checked out. So then you go to the next level. So that's how you handle the pain. The lump. I think we discussed the lump pretty much in detail.
Sure.
So yeah, so just a little bit more, okay? We have a slide, I think, on the lump, if I can show it, please. These are the different types of lumps that you can have in the breast, okay? An abscess, a fibroadenoma, a cyst. These are the most common ones, okay? Abscess can mostly, like I said, is usually it happens in these women with breastfeeding, because the duct gets blocked, milk duct gets blocked, the milk sort of collects, and because it collects, what happens is some bacteria will develop and there might be an abscess formation. Solution for that is very simple. You have to do, cold, hot compresses and some kind of massage, and usually it releases. Another thing which advised here is women tend to stop breastfeeding at that time, which is wrong. Should continue breastfeeding, because that sucking action will help that duct, to release the block and get the flow. In fact, if the need be, the patient, the lady is being treated with antibiotics, that's also fine. Even if the antibiotic is passing through, because the doctor will not give her any antibiotic which is harmful to the child. And even if it goes to the child, it will be destroyed in the child's stomach. So it is good to continue breastfeeding. Okay. Then we come to fibroadenomas and cysts. Now, cysts, like I said, fibroadenomas will occur in the younger age group. The younger age group is their breasts are forming, the hormones changes are happening. So these are the ducts and lobules which are growing, and so they tend to sometimes cause little growths, which are called fibroadenomas. These are benign masses and they are very classical. They are small, tiny, usually one, maybe a more, and usually around the nipple, maybe somewhere else. And the doctor can identify it on palpation and on ultrasound as well. So that's a fibroadenoma. Cysts usually occur in older women, and these might come up suddenly. That's when they might cause pain. So that you have to puncture it. And I mean, again, it's picked up on an ultrasound, because an older woman, more likelihood of cancer. So you definitely get an investigation done, an abscess, the needle is put in and biopsy is done, and that fluid is removed and checked out. Fibroadenomatosis is a condition where the breasts are lumpy. There are multiple lump kind of masses all across the breast, and that is again a benign condition. When there is a lump which is dominant, which is when you get worried, is that you get all these little things, right? But you find that one lump is different from the rest. That's what's called a dominant lump. That's when you start getting concerned and look at it further. Okay.
Sure.
Right. And then we discussed the others, which were the nipple problems I discussed, and the nipple discharge I discussed already. Right.
Sure.
So, let me take that off. Thank you. Yeah.
Well, Dr. Gabula, what do I say? What do I really say? The talk session was phenomenally high on the educative elements that you shared. And I'm sure that our audience would have found the talk incredibly important for their future well-being. Thank you. Thank you so very much, Doctor. I know we're going to have more of you with questions coming from the audience, but before we do that, we have a few important announcements to make. And I'll go straight to the announcements right now. But I'd like to remind our audience, if any one of you still have any questions, please go ahead, post your questions on the YouTube channel. We would be happy to pose them across to Dr. Gabula, who will be delighted to answer your questions. Coming on to the announcements, ladies and gentlemen, our 7th virtual live talk show under the Knowledge Worth Having series will be held on Sunday, the 21st of November, 2021, at our normal 11 a.m. time, only on the Catholic Gymkhana YouTube channel. The topic for this talk is I and you. And before someone gets me wrong, it's I as in eyes, okay, and you. Our speaker for this talk is a young but prominent eye and refractive surgeon, Dr. Ryan D'Souza, who's attached to the prestigious Leeravati Hospital in Mumbai. Dr. Ryan will help us understand common eye diseases and will provide us newer perspectives as well. Most of us are aware of common eye diseases like cataract, but there is a universe of eye disorders which are becoming increasingly common in an ever-challenging world, or an ever-changing world, if I may. Sadly, some of these are silent diseases and often result in irreversible forms of blindness with devastating medical and socio-economic ramifications. Dr. Ryan will demystify some of these myths surrounding these conditions, and importantly, will help us understand the 21st century perspectives surrounding these diseases. We strongly recommend that all of you, irrespective of age and gender, attend this talk show, which is expected to be very revealing in terms of newer diseases and possible actions in dealing with the same. So be there on Sunday, the 21st of November, 2021 at 11 a.m. sharp Indian Standard Time, only on your very own Catholic Gym YouTube channel. Ladies and gentlemen, it's now time for us to get on to the question and answer session. I know some of you have sent questions in out here. Dr. Gabula will address these questions right now. Dr. Gabula, I seem to have about 4 questions already. We'll get straight away into the question and answer session. In fact, I'll probably take the first and the second question together since they seem to be related here. All right, they also seem to have come from the same person. Let me read both of the questions to you first.
Yes, of course.
Why is it believed that in the late 1960s and early 1970s, that Parsis seem to have the highest rate of breast cancer? Why? I really don't know if this is a factually correct statement, doctor, but this is what's come from our audience. And there's someone in the audience who believes that in the early 60s or in the late 60s and the early 70s, Parsis have the highest rate of breast cancer. Is there any special reason for that? And I'll take the second question along with the first one since it's related as well. Does lifestyle play a major role in breast cancer? And the reason why this person says this is, they go on to say, Parsis and Catholics seem to have an almost similar lifestyle. All right. So why is it that Parsis have a higher rate of breast cancer?
Okay.
Is there something specific that's related to Parsis, or is it just, yeah?
Thank you. Thank you. Yes, a very interesting question. And about the Parsis, I am not so sure whether there is any study done in India as such. If you do know, please do share with me. What I do know is that in the Western countries, they have records. And there are familial traits. There is a family history. So if there is like I already told you, right? I can do it again. So the thing is, if there is one person in the family who's had breast cancer, the risk increases by 5%. And if there is more than one person, the risk increases by 13.8%. Now, if in a small community like the Parsis, if there is a family history of breast cancer, the risk is definitely more, right? And so there would be some kind of trait. Genetic abnormalities have not been identified, the familial traits have been. So these are two different factors, but studies need to be evaluated. I'm not certain about if there is any study in this case. The diet and the lifestyle. Yes, of course, lifestyle does have an effect. They have found things, right? With the research that has gone on, there has been a relationship between the lifestyle and which increases the risk of cancer, because if you do have dormant cancer cells in your body and your lifestyle is promoting their growth, like if you have unhealthy food and no exercise, too much red meat, too much alcohol, and these things will help those breast cancer cells to grow. They'll say, wow, this is great for me, come on, let's go. So that's where it will happen. Yeah.
So if I've understood you correctly, doctor, what you're saying is that it's not necessarily proven that it's partially related as a community, but the lifestyles could of course influence cancer.
Yeah.
Is that correct? Yeah.
See, but if not necessarily, no, I don't say that, Sanju. I am not sure if there is a record, if there has been some kind of a study done. If there is, then that would be. But it is a familial trait, yes, that I can accept. Again, I am not aware of this. I know of the Ashkenazi Jews in New York, which is where there was a lot of work done, and that has been found, and there is a relationship found and documented. So of that I am aware. Yes.
Sure. All right, we'll move on to question number 3, and I can see a flow of questions coming in now, which is good. So we have at least 6 questions. I've already done 2, doctor. Let me get on to question number 3.
Thank
and
you.
this is what the person says. I'm getting constant spasms under the breast. Could this be a sign of cancer? The person also goes on to say that my breast feels very heavy often. All right, so constant spasm and the breast feeling very heavy. And the person would like to know whether these could be signs of cancer.
So first is, it's only one breast that is having this problem. I mean, this is something that the person has to understand. So one is that if it's only one side that is having this problem, or is it both sides? You have to look at your age, right? And then is there any kind of swelling and discrepancy in size of the breasts that you have noticed? All of these factors have to be considered before you can do the next thing. Do a breast self-exam. Feel yourself. If you find there is some issue, definitely go and get it checked out. See a doctor, get a clinical examination done. And if the doctor feels, then you have to go in for the next step, which is the ultrasound, mammogram, etc.
Sure. All right, we move on to question number 4, doctor. When one's breast nipple turns slightly inwards, is this a sign that you may have breast cancer?
Yes. Yes, when you normally have the nipple facing outwards, and then you notice there's an inversion of the nipple, it can be an early sign of breast cancer. Please get it checked out.
Okay, so this is a new trend from the outward moving into the inward, and that's the reason why you're prescribing that. Is that right, doctor?
Yes, yes.
All right.
Inversion of the nipple, yes.
All right. Okay, we move on to the next question, question number 5. If there are any more questions, audience, may I request you to please hurry through, put your questions through on the chat. We've got the last 2 questions coming up here. I was given to understand that if you have cancer of any organ, the root is not in the cancerous organ, but elsewhere. Is this true?
No, I didn't understand. Can you repeat that question?
I will get through this question again, doctor. And this is what the person says. I was given to understand that if you have cancer of any organ, the root cause or the root cancer, the root is not in the cancerous organ, but could be emanating or could be starting from somewhere else. Is this true, that it could be starting from somewhere else, but you are actually feeling it only on some other part?
Now, this is a little convoluted, but bottom line is, yes, sometimes you find the secondary and not the primary. The secondary is when it has spread from the primary.
Sure.
We are talking about breast cancer here. Breast cancer is a very visible cancer. So usually if you get, you very rarely will you get the secondaries of the breast cancer before you get the primary. You will get the lump, you'll get the discharge, you get something or the other in the breast before you'll get, metastasis in the brain or in the liver or the lungs or the bones. Yes, ovarian cancer has this problem because ovarian cancer is not visible. It is not a identifiable cancer. It presents in various different ways. It doesn't have a classical. So that is one of the advantages of breast cancer. I mean, if you want to call it that. So you can catch it early. That is why this promotion, this awareness is important, because we can catch it early. It is a visible kind of cancer. This ovarian cancer is a horrible one because you don't know. You might find it spread to your liver, you got spread to your lungs, your brain, and that's when you, oh my God, there's a cancer in the ovaries, that's why. So yeah.
Sure. So as you rightly said, doctor, the very fact that we're talking about breast cancer today, right? And you're telling our audience upfront that breast cancer, you're lucky you can pick it up early. That's the message you want to give to people, I guess, today, right?
Yes.
All right. Okay, we're moving on to question number 6, and I see we have a 7th question coming as well. Are there some more coming in? All right, we have 7, and moving on to the 6th question now, Dr. Gabula. How often should one do a mammography? Should it be done once a year or once in 2 years?
Okay.
How often should one do a mammography? Once a year or twice a year?
Right, once in 2 years. Now see, this again, earlier it used to be told, everybody do it every year. As research, has understanding, has progressed with the risks that mammography poses, now they don't advise doing it every year unless there is an indication. So you do your mammography at the age 45, then you see your doctor. The doctor feels that this is a pretty normal mammo, in which case then they will advise you do it after 2 years. But if they find that there is little bit of doubt, if there is a family history, you have health issues, you have, diabetes, hypertension, whatever, stuff like that, and the doctor feels that this is a risk, they will advise you to do it every year. So it's a choice which is not for you to make, it is for your doctor to advise.
Okay. All right, I'll move on to the 7th question, and I can see some more questions coming in yet. Yes, there will be some more questions after this as well. Moving on to the 7th question now. Is there any treatment available in Ayurveda for cancer? The question coming here, finding out from you whether Ayurveda in any way can be a treatment for cancer.
See, I am an allopathic doctor. I believe in allopathy. I know there are many people who do a lot of other things. They do, various methods and cleansing and stuff like that. And it has helped. But where is the record? I mean, as an allopath, as a scientifically based person, we need to know, numbers that, okay, this is the rule, this is how it happens, right? All that is not available. And so I would not advocate Ayurveda as a treatment for cancer.
Fair answer, doctor. I'm moving now on to question number 8, and I presume this is going to be the last question, unless there's something that comes in the interim. Question number 8, doctor. It says, deficiency in vitamin D, women are likely to develop breast cancer. I'm presuming the person needs to know whether a deficiency in vitamin D will result into developing breast cancer. And there's another corollary to that question as well. It says, can vitamin B17, I hope I have this right, can vitamin B17 kill cancer cells? So 2 in 1 question, doctor.
So there are many theories out there about this vitamin B17, and there is stuff, and there are people who want to try everything out. So, but there is no proof as such. But if you follow that path, you can go down it. And do you want to see what we have in the allopathic path treatment is pretty much sure. You will get ABC and you're done. Yes, there are side effects which will cause a lot of discomfort and distress. But it's taking away that disease. You're not sure with the B17. I've read the books on that, and it didn't convince me. Not really, no. And the first part of that question was something else. Some vitamin B. No, I don't think that is a I don't think that is a valid
deficiency. Yes, the question was about deficiency in vitamin D.
No, vitamin D deficiency will cause bone problems. Yeah.
Okay, I think we are done with questions, at least for this morning, Doctor.
Thank you.
Thank you very much. We now move on to a very important part. It's really time for a special vote of thanks to you, Doctor. But before I get on to introducing our speaker, we all know with T20 Cricket World Cup on the horizon today, all right, we hear a lot about man of the match in cricket, all right? But for our talk shows, we have our own man of the moment to do the vote of thanks. All right, in cricket, you got man of the match. But when it comes to the knowledge worth having series, it's our man of the moment. Ladies and gentlemen, I'm referring to our very own Mr. Ian Pereira, who is a managing committee member and also a part of the technical team bringing the show live to you, along with Aubrey. Ian also happens to be the vice chairman of our PR committee, who along with our chairperson, Ms. Yvette Malgi, brings to you and to your homes all the promotional material for our events and newsletters. Being a prominent photographer himself by profession, Ian has a keen eye, which we all knew. But his newly discovered talent of spontaneously speaking was discovered only after he proposed the first vote of thanks. And if I may say now, and I know that if I suddenly fail to turn up on a talk show, Ian can step in easily. Ladies and gentlemen, without too much ado, I'd like to call upon Ian Pereira to propose the vote of thanks. Ian, please.
Thanks, Sanju, for the wonderful words. I don't think I can match up to your the way you speak and the way you handle the show. Anyway, thanks a lot. Thank you, Doctor, very much for the superb talk. The stats and the graphics shown, very informative, and I'm sure a lot of people have learned a lot. I mean, I've learned a lot today, which I didn't know. I'm sure it's going to be very helpful to many people. And this video, the recording of this will be on our Catechism channel. So please, everyone, please share it far and wide, so it helps a lot of people. And as Doctor said, early diagnosis, we all know any disease, for example, earlier diagnosed, it will be cured faster, especially breast cancer. So I suggest, thank Doctor very much for this wonderful talk. And Sanju, no one can beat you to this. This is your hobby turned profession, among other things you do, being the treasurer of CG, and very meticulous, and I know how much work has gone into this. And it's something that you really enjoy, and it's obvious the way you've done it today. Thanks. And thanks to Aubrey sitting in Pune, who's been collating the questions and passing them on to Nirmala and Trizal, that's Sanju's wife and daughter. And thanks all three of you for making the question and answers so smooth. We've had more than 100 people on the show today, and it's thanks to the communications team headed by Yvette. And so thank Yvette for the wonderful introduction today. And Doctor, thank you once again for this wonderful talk, and much success. Wish you much success in this BSc, the project. Yeah.
Thank you. Thank you so much.
Over to you, Sanju. Over to Sanju.
Yes, Doc, you were wanting to say something? You done?
I just wanted to say thank you for having me on the show. And yes, I appreciate it. And I hope I have convinced a lot of people to promote breast cancer awareness and to practice breast self-examination.
Thank you. Thank you so very much, Doctor. Thank you so very much, Doctor. Thank you very much.
Yeah. There is a website which I have, www.bseforlife. Sure. Which people can visit if they want to know more.
Sure. In fact, I encourage people to go ahead and visit that website. I'm sure you're going to find it very useful, interesting as well. Thank you once again, Ian, for that very spontaneous, it was as spontaneous as one could get, the vote of thanks. Thank you so much. Ladies and gentlemen, I'd like to remind you that we would like to see you all on the 21st of November, 2021 at 11 a.m. sharp for the 7th talk show. I also like to remind you that every Saturday at 9 p.m., we have something called the Members' Night with a live band. Encourage all of you to come, join in, have a great time on a Saturday night, sit down with your family, friends, enjoy yourselves. But before we end, ladies and gentlemen, I'd like to leave you with a very special wish to all our women, since this has been a topic especially for them, more especially for them. Women, we adore you and respect you for what you are. Most of you come to us in the form of mothers, others in the form of wives, some others in the form of sisters, and some others in the form of daughters. Whichever form you come into our lives, we sincerely hope and pray that you have a healthy body and give glory to God for his wonders of creating a wonder of a woman. With that, this is your friend and compere, Sanju Fernandez, signing off. Ladies and gentlemen, thank you, goodbye, good afternoon, and stay safe.